Talk about something spicy, like in the bedroom spicy on cancer and chemo. I know you haven't asked your doctor about this, so let's talk about vaginal atrophy. I was diagnosed with hormone positive stage 2 breast cancer 3 months ago. I'm currently undergoing TC chemo, and then I'll have radiation and probably an aromatase inhibitor with ovarian suppression. The side effect of chemo is that your ovarian functions will decrease, as in your hormone levels will be suppressed, and this will affect your chucha, and that affects sexy time. Aromatase inhibitors and medication suppression of your ovaries also will put you into menopause, also cause chucha changes. I also have stage 4 endometriosis, and 5 years ago I underwent a hysterectomy. My fallopian tubes and my uterus were removed. I still have my cervix and my ovaries. I didn't realize I was choosing between pain or vaginal atrophy. You're not as wet, and this can cause a lot of irritation and dryness. So you'll feel itchy and things will just not feel quite right there. Irritation when you're wearing clothes or sitting around. Another thing that can happen is the estrogen level can drop in your tissue, and that causes literal atrophy. Things shrink. Your clitoris can shrink, your labia can shrink, and all of this contributes to pain and discomfort during sex. What to do about all of this? We're still horny, we're still young, we're still gonna have sex, right? You want to still be able to continue this. It's cheesy, but it's a use it or lose it situation. The thing that helps is estrogen. There's recent studies and guidelines that have come out this year at ASCO, which is the largest cancer conference in the world. Recent studies are showing if you're not BRCA1 or 2 positive, you can use topical estrogen. It's just a cream that you put on your chucha. It's really like a microdose of estrogen. This keeps your vaginal tissue healthy and not atrophying. Physical lubrication that you put into your chucha that Bonafide makes these little inserts. Time for the bedroom. Have lots of lube. You want to make it comfortable for yourself, and maybe you haven't used that much lube in the past. Now is the time to use a lot of it. Experiment with different kinds and different brands. You might like silicone. Your body might not like it. I can only use water-based. I have my go-to brands. This is the same thing as skincare. You have to think about what works for you might not work for someone else. Find the right combination that works for you. You want to keep your chucha. It's going to be full on maintenance. Put a lot of time, energy into our face and our hair, right? So why not put that into our chucha? Another area where you really want to look into second and third opinions. Find a good urogynecologist, because not only does your chucha atrophy, you can have issues with your urethra. This is a urogynecology problem where you can have leaking urine and lots of other issues. There's also laser therapy, radio frequency therapy, a lot of things that you might want to explore with a provider that knows and understands the issue. You want to have someone that's listening to you talk about it. If sex is important to you, as it is for me, we're young people that want to continue to live our lives. Just take time to look into preparing for what's beyond. When winter is coming, you got to make sure that we are ready for it. If you have other suggestions and things that are working for you, spill the tea. Let us know what else we can be doing, and let me know if you have any questions.